And now, without further ado, I'll turn it over to Shannon to get us started with the good stuff.
Thanks, Tammy. Appreciate it. So we're going to go ahead and jump into our SOAR information. So every single SOAR that had rural health clinics disseminated information to their networks. We could not have done this program without all of you. We had monthly calls with the SOARs, which Tammy kind of talked about. We call those our C3 calls, our seed calls. We were so excited to see all of you participate. And again, all SOARs with RHCs participated and provided direct outreach to those rural health clinics. So for our direct TA to rural health clinics, we assisted as our team, we assisted RHCs directly with ways to spend their funds, the correct reporting requirements, what's allowable, what's not allowable. We spoke to clinics directly that wanted to return funds. We were able to help a lot of them with ways to keep those funds and spend them appropriately. We did lots of webinars, as all of you know. We did those directly to rural health clinics through the National Association of Rural Health Clinics, where we reached over 1,600 individuals on one call. We also surveyed rural health clinics to determine if the assistance that we provided was valuable. In addition, we created a document that walked the clinics through the reporting requirements, which was downloaded over 1,600 times. You have to remember we're at about almost 5,000 rural health clinics across the country. So I will take that download percent there. So what are some of those RHC comments that we received? Huge shout out to all of you. You can see I pulled several of the comments directly from our survey. So Alabama and Missouri and Washington and Florida and Kansas and Idaho and Tark and Mississippi and Kentucky, Louisiana, all of you. These are just a few that we pulled off of the survey, but what a way to get the information out to our clinics. This slide actually is going to show you from the testing information, did they receive direct communication? So as you see here, our percentage was really high that clinics received direct communication. That was our goal all along. And again, we couldn't have done it without all of you. So what are some of the comments that we received from rural health clinics? So these are some information was well received. The process was easy to follow. One of my favorites is at the bottom there. I'm not going to read them all to you here. I had a question regarding eligibility and compliance. After reaching out to the state level contact, I was forwarded on to a federal level contact who called me within 2 hours of my inquiry. So Terrell said at the beginning that our HRSA partners have been amazing, our Federal Office of Rural Health Policy. Yes, they have. They have gotten back to us and gotten us the information that we need. So we're going to jump into some of the RHC COVID-19 testing information and RHC COVID-19 testing and mitigation program, also known as CTM, so I don't have to say that 500 times, right? So our COVID-19 testing funds, again, NOSAR is here to work directly with rural health clinics on the reporting requirements, allowable and unallowable expenses. This was a partnership with the National Association of Rural Health Clinics for this project. By now, all of you should know we have a dedicated email address. So that's that rhccovidtestinginfo@nosar.org. You will get one of these people that are currently highlighted on your screen at the top. So one of us will be answering your emails. So what are allowable expenses? Now remember, this was the first payment. So this was the $49,461.42 that the rural health clinics received. This is primarily for COVID-19 testing and testing related expenses only. But now, COVID-19 testing and mitigation funds. So again, we're going to work directly with rural health clinics. We've done a lot. We've answered a lot of questions about what's allowable and unallowable. Again, a partnership with the National Association of Rural Health Clinics and that same email address that you probably have memorized just like we do at this point. So this grant, which was the $100,000 payment, was for COVID-19 testing, our COVID-19 testing related expenses, COVID-19 mitigation expenses, and then our COVID-19 mitigation related expenses. The link at the bottom here will take you exactly to the allowable expenses if you're looking for something in particular for one of your clinics. But again, reach out. We're here to help you. This is the website for HRSA's information for those allowable expenses. It breaks it down in those 4 categories that we told you about just a minute ago. So let's talk about some examples of allowable expenses. So these are some of the top ones that we've seen throughout the program. Hand sanitizing stations. So this is regarding our mitigation, our CTM funds, COVID testing mitigation. Replacing carpet. So replacing carpet if you have, some kind of incident, we can do that. Replacing cloth chairs. Again, infection control really is what about mitigation is here as well. These funds allow them to add to their waiting room to allow for social distancing. Ensuring water systems are safe. Hopefully by now everybody's water fountains are turned off and we can figure out a way to repurpose those, because we can't guarantee that we're cleaning it after every single person or patient. So maybe you use a water bottle filling station, or maybe they put out a water cooler. Again, lots of ways to do it. Heating and air systems are safe. If they need to purchase a purification system, they can. Retention payments to staff. Boy, is that a hot topic lately. We're very excited to see that one. We've been in this a year and a half now. Hopefully we're going to come out of this at some point soon. And then hiring bonuses for new employees for COVID testing as well. So if a clinic is struggling to hire someone, maybe it's a nurse practitioner or CMA, they can actually use their mitigation funds for a bonus payment to help bring on a new employee. Of course, we have our PPE, and then digital technologies is one of those really amazing opportunities. So if they need to expand their telehealth capabilities, fantastic. If they want to buy a laptop with a good camera so that they can do telehealth visits, absolutely allowable. There are so many options out there now that I don't think we have not seen a lot of interest yet in the digital technologies. It's coming. We're getting there slowly, but. And then what are the deadlines? So this is what we have to make sure that we get back over to our clinics. So the payment for the $49,461.42, that is actually up December of 2021. So a little more than a few months out. The $100,000 payment, or up to $100,000, is not doesn't have to be spent out until December of 2022. So we have a little bit of time on that one, but they do need to get their funds spent for the COVID-19 testing. If they have funds left over, we will work on getting that process to you about them returning those funds. We know they were able to use a lot of these funds. We're hoping they can continue to do that. And then last but not least, we have one of our RHC vaccine confidence grants. So I'm going to transition over to Lynette, and Lynette's going to tell you about the fabulous work that they've been doing over for our RHC vaccine confidence grant.
Shannon. So the next program that we have is the grant program. So as a reminder, it is a grant, which all of you are well familiar with grants. However, the testing and mitigation was a federal allocation where the funding was dropped into their bank accounts, and now they're determining how to utilize it. The grant is a little different, and so for many of our RHCs, as you well know, aren't used to writing grants, so helping them understand how to manage a grant in addition to how to utilize the grant. So first of all, the state breakdown, which is a pretty tiny font. Hopefully you can see it on your slides, but you can also access this online at the HRSA grant find grants website. And I'm sure by now most of you know the clinics that have received grants within your state. I think there's only one state that ended up not having any grantees, so they were fairly well distributed. We had 790 grant awards, so HRSA was thrilled with the response. They really wanted to get the dollars out there to the rural health clinics, and they were incredibly flexible with the awards that they received and funded. And so they ended up just about every single one received $49,529. They initially said to budget for 50. So it came out really close to what they anticipated. So they were thrilled with the response on this particular grant program. So the general purpose of this grant program is to help increase vaccine confidence and uptake. reinforce messages in prevention and treatment of COVID-19 and other infectious diseases. So if you aren't aware, and many grantees didn't quite catch that when they were busy trying to submit their grants, this is not just for COVID-19, it's for other vaccines that they're doing, immunizations, which is wonderful. I think of on the R-Corp grants, where at the beginning, some of the opioid related were only opioid, and that restricted folks and a little bit, and then later they did include the substance use disorder. So this is a similar thing where they were able to include other infectious diseases. So it's not solely tied to COVID-19, although that's, of course, the general focus. Education and outreach efforts related to getting folks to actually get the vaccine, and then the promotion. So it's really a lot of the work that folks are already doing, and maybe some other creative things that they didn't have funding to do, to get folks to be willing to get the COVID vaccine and their other immunizations. It's what we say is it's nearly everything. I hate to say everything, nearly everything up to giving that shot in the arm. So administration of vaccines, any expenses, staff time, any related are not allowable on this grant, but much of the good work of getting folks informed, helping them know where the vaccines are being provided, and even transportation to get to a clinic or a community outreach site is all allowable on this grant. So a few of the things that are allowable would be community outreach, if they wanted to purchase a tent to do community outreach, if they have supplies that for pamphlets and brochures and signage. Many are investing in marketing and promotion that they probably didn't have funding to do, in getting that messaging out related to vaccines. Some are doing testimonials from folks within their communities that are champions of getting the vaccine, and recording those, maybe paying someone to record those and put those on the website. But investments that they may not have had dollars to do. So similar to what we did with the testing and mitigation, is if they're stumped on how to utilize these dollars, we have calls with them and we work with them on, coming up with some ideas, because it's more than likely they're doing the work. It's just how that it fits and how they can, what's allowable in this particular funding source, but also leveraging the other dollars that they've received, such as what Shannon just mentioned. So the technical assistance that NOSOR is doing, we initially, all of us, it was all hands on deck when the grant was due in June. So we helped many, many folks just get a grant pulled together. Terrell did a great webinar prior, and we had some really good examples. And we really were encouraging folks, just take this template, modify it to your needs, and get it submitted, because HRSA did end up funding nearly every single applicant that applied. I think there were just a handful, maybe 10 or so, that weren't eligible that applied, and all the other ones were funded. So that's pretty phenomenal, giving close to 800 grantees receiving dollars for this purpose. So we worked on the front end, and now we're working as they receive their dollars. They were awarded in July. Because of the flexibility of HRSA, which is awesome, probably a third have budget revisions and work plan revisions that are needed. And so we're working with them to meet those requirements to get the budgets and work plans revised. And then once they're all have notice of awards and they're ready and they can actually draw down the funds, just answer those continual questions on how do I go into electronic handbook? How do I use this payment management system? Because again, as you all know, most of those RHCs have never had a grant before. Many are health systems, so they have that support. But a lot that we're talking to, the providers, I just talked to one the other day, husband and wife are the providers. They are the administrative folks, and maybe have one or two more people in their office. And they're like, we don't know where to start. And so that's what has been really fun to work with folks around the country to help them hopefully build capacity in managing grants. That's our intention, and not be afraid of having a grant in the future. And that's what we've all been doing. And then we're really excited to have some extra hands on deck with our SOAR champions, as Tammy mentioned earlier. They'll be working with any state offices also to support the RHCs that are grantees, however you're able to work with us. The funding period for this particular grant started July 1. It's just a 12-month grant. They are able to go back into March with some expenses retroactively, but ideally the funding period is this 12 months that you see on the screen. We have a dedicated email address, which many of you have emailed us on and referred folks to, and that's on the slide. So we encourage you to continue to have them reach out to us. If you have any questions, any of you or any of your RHCs, you can reach out to us and we will respond and get answers for you. And as Shannon said, we're working really closely with the Federal Office of Rural Policy. And if we are unable to answer questions, then we will connect with them, and we meet with them on a weekly basis, 2 or 3 times. And we're working across all the programs, which is really fun because we're able to answer most, maybe not all, questions on all these programs together. So that's been I think a real bonus of working together on having input on all these programs. I think that, here, I got to remember to advance the slide. So next I'm going to hand it off to Jill, and she's going to share about the vaccine distribution program.
Thank you, Lynette. As most of you know, the other 2 programs came first. Vaccine distribution was third in the trio, but really an important program that I want to make sure everybody's familiar with. So the vaccine distribution program will distribute COVID vaccines directly to rural health clinics. This is solely to increase the availability of COVID-19 vaccines in rural communities. At first, we really know that the vaccines were hard to come by. They're awful plentiful now. But the beauty of this is really to be able to increase that vaccine accessibility to our clinics in those rural areas. One of the things we share with RHCs is that they can order all 3, 1 or 2 of the different types of vaccines that are available. And this is really helpful, especially if they know there's a prevalent preference of a vaccine in a particular clinic. They can order a direct allocation from the federal government. And something to note, this is in addition to their state allocation. And it's nice to be able to have this available to them. HRSA enrolls the actual RHCs into the program. So clinics go onto the HRSA website to enroll and ensure that they meet the eligibility. Unlike the 2 other programs, this program is directly through HRSA, and then there's an additional TA component. So I did provide the RHC Vax distribution at HRSA.gov for questions directly going to HRSA, along with the link to the vaccine distribution site. But for TA, which we have understood to be a little bit challenging at times, HRSA provides the request off to Georgia Health Policy. And then Georgia Health Policy triages it and sends it over to one of the additional TA providers, which is the National Association for Rural Health Clinics, NRHA, or NOSOR. And so we have gotten a number of different TA requests. They do prefer us to follow up with a phone call or an email, but we have 24 hours to respond. So it's a quick turnaround time. A lot of that turnaround time, we do think that we need to have that a little bit more of a rapid response due to the multiple layers. And once the TA is closed out, we document our information as appropriate. One thing I really, really want to impress upon the group is how can all 3 programs be used together. So, our vaccine distribution is probably, as I said, the last in the tier of the 3 tiers, but it's one of those parts that I think is really important to share with clinics that they can sign up. But most important is to be able to share of how all 3 programs can be used together. So we know COVID testing and mitigation funds, federal allocation, vaccine confidence was your grant, and now vaccine distribution is made available to our clinics. One of the roles that I think SOARS can play is really sharing with the clinics of how they can really capitalize on all 3 programs. RHCs are in the hot seat. They are in the direct public eye, and it's great. We were excited to see that they're getting all this additional support, but now let's help them understand how they can best utilize that support. So CTM, Vax Confidence and Vax Distribution, for instance, if a clinic, as Lynette mentioned, asked for a freezer within their Vax Confidence funding, that's not an allowable expense. However, a freezer under COVID testing and mitigation is an allowable expense. If you have a tent and you ask for a tent just under Vax Confidence, well, you can use that for Vax Confidence, but you really can get a tent, the max use out of that, if you have not only Vax Confidence education in vaccines as a whole education, but then you can provide testing, you can provide other education and services, and you're really capitalizing on all three programs. As Lynette and Tammy and Shannon already mentioned, we have the team that answers all of the questions that come into us the best of our ability, but HRSA has been a great partner in this. And if there's something that we're not familiar with or we don't have answers to, they're quick to answer us and provide support back to us as the TA program. We're happy to present at national and state partner organizations. We know these programs inside and out now, and as technical leads, of course, Shannon is on vaccine confidence or vaccine testing and mitigation. Lynette's on Vax Confidence, and I'm on Vax Distribution, but we really have tag teamed for each other. Lynette has a booked schedule full of TA calls. I'm checking the mailbox. If Shannon's out, then Lynette and I are looking after things. So it's an awesome team, and we're here to provide support to all of you to support your clinics. So we continue to support them, and we're excited about the program as it continues. I just can't say enough about the team and the great work that they've done. So here's kind of a breakdown of our contacts. Of course, the two for testing and mitigation, and then for Vax Confidence, the direct emails to NoSOR. Shannon's contact mine, and Lynette and Tammy. Feel free to reach out to any single one of us to be able to provide additional resources, assistance. Even if you need to get us on the phone along with your clinic, we certainly want you to keep that connection with your clinics. But the three of us on the phone, happy to do that as well. And I am going to pass it back over to Tammy. And Tammy's still on mute.
I'm glad Ashley did that first. We really appreciate the opportunity to share a bit of this part of our story with y'all and this work. So as we prepare to move into our investing partner break and then on to our next session, please start to think about how you might encourage your rural partners to participate and celebrate, and yes, I'm going to say it again, have cake, for National Rural Health Day. What a great reason to reach out to your rural safety net providers and nurture relationships. Remember, resolve to ensure rural communities we serve have access to the tools and resources needed to meet challenges of the ever-changing landscape. Stay the course, demonstrating and encouraging self-care and resiliency. Be ready to meet rural communities where they are and any challenges that might arise, and be committed to establishing and nurturing relationships that assist rural communities we serve become and remain more well. That is the SOAR commitment to technical assistance. And again, we appreciate the opportunity to be with y'all today. And as always, don't hesitate to let us know if you have questions or if we might be of assistance. That's why we're here. But before we move on, here's a brief word from our Rural Innovator partner, Ide Bailey.
Good afternoon. I'm Ralph Llewellyn. I'm the partner in charge of critical access hospitals and healthcare consulting with Ide Bailey. Our team consists of over 200 staff and 40 dedicated healthcare consultants. Our backgrounds include former hospital CFOs, business office managers, nurses, health information management professionals, and Medicare auditors, and more. We're fortunate to have the opportunity to work with state offices of rural health and rural providers as they navigate the ongoing challenges in the healthcare industry. Our team can assist you and the providers you are working with on impact analysis of new regulations, such as the new Rural Health Clinic caps and upcoming implementation of the Rural Emergency Hospital Program. Financial and operational reviews to assist providers in improving their overall financial performance. Cost report analysis, helping ensure providers are getting the reimbursement they've earned. Revenue cycle performance, including compliance, operational assessments, charge master accuracy, and pricing transparency. And nothing would be complete without data analytics. Creating and implementing strategies to deliver the data, information, and knowledge needed to manage healthcare organizations. We look forward to the continued opportunity to work with you and your providers in the future.
Awesome. So, and now, time for a break. Stretch, get a snack, make sure to swing back into the Crowd Compass app and visit our investing partners. And these 4, plus the compliance team, I understand, have virtual rooms that you can visit. So make sure you stop by and do that. You'll find each of their room links in Crowd Compass. So we so appreciate these folks as well as our other investing partners. So make sure to show them some love for sharing their time, talent, and unfailing support of No Store Work and the mission. So we'll see you back at 3:15 for the breakout sessions. And don't forget to check the agenda in Crowd Compass. Now, ready, set, go. Thanks, y'all.